Okay, testing. We could be live. We could not be live. Is it live? Are we live? Are we live? Nope. Let's see. Go to. It's always so puzzling to me. Why? And I could be talking, and this could be recording, and then it may not be, but I'm not sure. YouTube is not currently receiving data for the stream. If you believe this is incorrect, ensure you're sending a stream and that it's configured with the correct stream key. Okay, we are. Copy. So live page. I think we're good. So I'm gonna start talking. I'm gonna start talking, and we'll just go from there. So it says if 5 people are watching, that's fantastic. If you have knee pain questions, type them in, and if I'm technologically savvy enough, I will see them somewhere, either today or I'll see them somewhere else, and I'll answer them and answer them on one of the subsequent videos. But today, what I wanted to share with everyone was got some really cool stuff going on at the website, thekneepainguru.com. If you go thekneepainguru.com/live, these videos will be posted on there. So I'll be doing them daily, every couple of days. It's way easier for me to answer questions about knee pain. I can talk a lot better than I can write. So that'll be a real benefit to be able to answer the questions this way, give you direction, make distinctions, because understanding how to get out of knee pain is very different. My approach is very different than what is out there as far as the conventional medical model or physical therapy, massage therapy, personal training. First and foremost, we got to get you out of pain. When you're out of pain, then you can start functioning. But if you're in pain, if you're starting out in pain, anything from that point is just going to further embed the dysfunctional neurological pattern into your body that keeps you stuck in pain. So we'll get you out of pain first, and then we can start ramping up what's going on. But today, what I wanted to answer, I got a question the other day, and it was really good. And I just had to restart my computer. This has been quite an adventure here. Here we go. Okay, the question is from Nelson. I spoke with Nelson the other day. I told him it's important. The conversation was around helping him with the pain in his knees. I'll read you his question right now. He's out of Puerto Rico. And we had a conversation. And you mentioned in our call, if a diagnosis did not indicate that something was torn or broken, you can help me be pain-free with your recommendations, such as the stretches. I reread the MRI email to you and discovered the following horizontal peripheral tears concerning portions of the anterior horn lateral meniscus and posterior horn medial meniscus. This indicates that I do have tears. So what do you recommend? Can you still help me? By working with the 3-step approach of mindset, physical, and diet, or will I need surgery to repair the tears before we continue? Thank you for taking my question. So this is a really big distinction here we need to make. First of all, it's important you go to the doctor to get your knee checked out so we know what we're dealing with. Once we know what we're dealing with, there's either something broken or torn or nothing broken or torn. If there's nothing broken or torn, we're only dealing with pain. We're only dealing with irritation of the nerves in the knee. However, if something is broken or torn, then we have to look at the degree of tear, how fast you want to get back into your life, and do you have the patience to work with your body and set up the conditions that allows it to heal without the surgery? Because I believe your body has the capacity to heal itself. Now, doctors and physical therapists will say that the meniscus can't heal because of the blood flow. Well, possibly. However, if you break a bone in your leg and the doctor puts a cast on it, you immobilize the leg for 6 weeks, 8 weeks, maybe a little bit longer, the bone heals. The meniscus or the cartilage is at the end of the bone. Why can't that heal as well? I don't see any good reason why it wouldn't be able to heal if we immobilized it, if we set up the conditions so now your body's going to be able to heal it. We reduce the inflammation, we keep your mindset in a good place, proper supplementation to make sure your body has the resources it needs to heal your knee, create pain pattern interrupts to get the pressure off of the nerves that are causing the pain. Why couldn't the meniscus heal? I don't see any reason that it couldn't. Maybe on an old paradigm or an old model in terms of how you look at the body, that if you're continuing on in your life, you're not giving your body time to rest, that it couldn't heal. However, if we take this different approach, if we're looking at your body as a system, if you have inputs on one end of the system, your body's processing this information, and then you have outputs on the other, and we start putting different inputs in here and see what happens along the way, why couldn't it heal? I don't see any reason. There are certain instances, depending on the degree of tear in the knee, the doctors will either say it's small enough that it could heal, or they'll actually stitch the meniscus up and allow it to heal. So there's something there. There's like a disconnect here. Like a logical progression. There isn't a logical argument of why a meniscus couldn't heal. And if we're just going to default and say, well, because of blood flow, it doesn't make sense to me. With that being said, answering Nelson's question, if we make sure we're creating pain pattern interrupts, getting the pressure off of the nerves and creating comfort in your knee on a consistent and a regular basis, you're not in pain, one. Second, we reduce the inflammation both locally in the knee, globally in the body. We free up the resources. So now your body's going to be able to go to the knee and heal what's going on because you have this extra amount of healing resources to do so. And then mindset, realizing that you're going to have good days and bad days. And on the bad days, you go back to the basics, which is creating the pain pattern interrupts and reducing the inflammation. And then on the good days, make sure you don't do stuff that's going to actually throw you back into the pain tension loop and cause the pain all over again. It's a very simple approach. However, if you're consistent and committed, do it on a daily basis. I've seen absolute phenomenal things. I've had clients come back and say they did an MRI and their ligament was completely torn. And then they did an MRI several years later after following my approach, and the ligament reattached. Now, can I prove that? No, because there's a lot of variables that go in there. From a scientific approach, they're going to want to have, a specific condition, specific variables, and they're all controlled. However, when you go to sleep at night, your body does what it does. It knows how to heal itself. It's a very simple approach. I'd say it was necessarily easy, but it's simple. Anyways, so let me see if I could find questions somewhere in internet land. see what's going on. Laura, hey. I have pain in my right knee and was told by the orthodontist. That's for your teeth. Orthopedist. My right knee is wearing out on the right side of the knee and lately has been going to work in pain. I don't see a question in there. You're going to have to be a little bit more specific in terms of like typing a question. If you're asking me, can your knee heal? Absolutely. I have a 3-step approach. First is physical, second is diet, third is mindset. I covered that earlier. On the physical piece, your body is stuck in a pain tension loop. The nerves are being irritated in the knee, causing pain. Your knee tenses up to protect itself. That tension reduces the space in the joint. The reduction of space irritates the nerves, causing the joint to tighten up more, causing more pain. So the more pain you feel, the tighter the joint gets, the more pain you feel. The key there is creating what I refer to as pain pattern interrupts, which is creating a tiny little bit of space around the nerve. When you get the pressure off of the nerve, it's like removing a splinter from your finger. That little bit of space gets the pressure off of the nerve. You feel relief pretty immediately, and that relief causes the joint to relax and create more space. So the more you get the joint relaxed and create more space, the more comfortable the joint gets. The body heals itself faster when you're not in pain. It's a completely different neurological state in your body when you're comfortable as opposed to when you're in pain. So that's the first step. That's a physical step. Second is diet. Reducing the inflammation both locally in the knee and globally in the body. When you're in pain, the knee swells up. So you have inflammation, both locally in the knee and globally in the body. Locally in the knee because of the knee pain, globally in the body from the foods that we eat, the water that we drink, the air that we breathe. The nature of being a human in pain causes global inflammation in the body. By reducing that inflammation both locally in the knee and globally in the body, we free up your body's healing resources. So it's not going to your gut, your brain to heal the inflammation in those places because those are priorities. You don't need your joints to live. So once we address the gut and the brain, reduce the inflammation there, it frees up the resources that you have more left over to go to the knee and heal what's going on in the knee. So that's the second. Third is mindset. The reality is getting out of knee pain is not linear. You're going to have good days and bad days. That's just the fact of what we're dealing with. And on the bad days, you go back to steps 1 and 2 of creating the pain pattern interrupts and reducing the inflammation, shortens the duration of the bad day. And then on the good days, when your knee feels good, it's refraining from doing the things that are going to throw you back into pain. Meaning I have clients that the minute they're out of pain, the minute you get the pressure off of the nerve, their knee feels better. And when their knee feels better, they go out running, working out, doing whatever they did that put them in pain to begin with. Even though the body's not out of pain, doesn't mean it's healed. So we need to give it a little bit of time to heal. And just follow those 3-step instructions on a daily basis. Amazing, amazing things happen. The body gets out of pain, you're living your life. We got to do it intelligently. This isn't just like, a templatized approach that is going to, it's got to be custom tailored sometimes. Laura asked about getting my approach. It's actually 3 steps, not 5 steps. You can go to thekneepainguru.com. Tons of information there. If you want to get started today, I would go check out my Get Moving Again program. Go to the bar. There's a knee pain products at the top. And there's, I think, 4 down on the knee pain products page is my Get Moving Again program. That's a great first step. and then set up a time where we can talk. All the information's on there where we can set up a time to talk. I'll custom tailor a program for what you have going on. Okay. Rombo166. Morning, Bill. Was going to have a partial knee replacement. Kneecap only on left. Kneecap is bone on bone. Working on your stretches to make space underneath the kneecap. Twisted the knee hard. Cracked it. And from that minute on, I've had swollen lateral side of kneecap over port area. They put a shot that have nerve pain in the spot 24/7. Doing all your stretches. Okay, Rombold166, when you're doing the stretches, you want to make sure that everything you're doing is comfortable. Nothing in any of my stretches, the passive stretches or the pain pattern interrupts, are supposed to create pain. And if you're creating pain at any level, you're not doing the stretches correctly. That's just being straight with you. So especially if the knee is very painful, very sensitive, you want to go subtler, more gentle, and at comfort level. So you have to dial that in. And you essentially, what my program is doing is teaching you how to feel to get out of pain. Knee pain is a feeling. You feel pain. It's not an intellectual process. So in order to get out of pain, in order to find your way out of pain, you have to feel your way out of pain. And this is difficult because we live in a society where it's like, no pain, no gain, just do it. Pain is weakness leaving the body, push through the pain, which all has its time and place. There is a time to push the body, but not when you're starting out in pain. That's not the time to push through pain. So we got to get the general level of pain in the body down. And when we get the pain level in the body down, then we can start amping up the movement, if that makes sense. Okay, let's see. This actually went well. It took me a week. Got the technology down. All these videos are going, so everybody, what to do after this, you can go to my website, thekneepainguru.com. If you put /live, L-I-V-E, this is where all these videos will be listed. You can get into one of my programs. You can set up a time to speak with me. You could speak with me, and I'm going to tell you the very same stuff. It's a very straightforward approach. All on my website, thekneepainguru.com. Check it out. There's lots of information there. I'll be putting these videos on a regular basis. You can also, there'll also be instructions on how to follow. So you get a text notification on your phone when I'll be doing the next one. I'll send it out through my phone. You can get a notification, I'm going to be live in 10 minutes, and then you can jump on the kneepainguru.com /live page, and the video will be there. So that's what you got. I'm going to wrap it up for today. Thank you so much for asking questions. It's actually really cool to be able to help. I enjoy it. I enjoy the body. I enjoy the mysteries the body has and how it works. It's coming up on 2 decades since I blew out my knee doing this. So I have a lot to offer and just want to be able to share. Want to be able to help. So there's lots of cool stuff coming up in 2017. Go to the website, thekneepainguru.com, be part of the conversation, ask questions, and have a wonderful day and a wonderful rest of the week.